In this video, we will discuss about the CAR-T results with different bifunctional antibodies in the in vivo system. In the previous video, we have discussed that in the in vitro system, they are able to see the results from which they are not able to conclude whether PD1, PD-L1 ligand is necessary or it is not necessary. So they decided to do the experiment in the mouse model, or they decided to do the in vivo studies to check whether they will get any consistent results from which they can predict which combinations with this CAR-T works well and which combinations has the optimum effect on the tumor reductions. So this is how they designed their experiment. They took the mice and inject them with this tumor, that is PTEN-Kras hpSCA, with the humanized version, and then after around 16 days they inject this Psi drug, which is a kind of immunosuppressant which is necessary for any kind of before most of the immunotherapies, because if the immune system is active, then the efficiencies of the CAR-Ts that are induced later will be reduced significantly. So this is a standard practice to reduce the immune system of the host. So they have used the Psi drug, and at 0 time, after 1 day, they inject the CAR-T cells with different combinations, and at 6 days they have collected the serum, blood for the cytokine analysis. And what they are able to see, so results, first they have shown the results of the tumor volume. So in the tumor volume, they can see that when there is no CAR-T has been introduced, then they are able to see a continuous increase in the tumor growth. But when they introduce the CAR with anti-PD1 and anti-PD-L1 and IL-2, they are able to see a maximum reductions in the tumor volume. And even in the case of where they use the mutant, they are able to see a highest or maximum reductions compared to the other leftover combinations. So far they are able to see the best combinations that works for them is with this anti-PD1, and they can see the reductions in the volume with mutant anti-PD1 and anti-PD1 also. However, the decreased tumor volume with this anti-PD1 wild type form is the better combinations compared to the case where they use mutant PD-L1. That can be seen in the panel B. In the panel C, they check the probability of survivals, and they are able to see that survival probabilities are usually high or highest in the case where they use anti-PD1, L1 and IL-2, and even in the mutant case also it is highest compared to the other combinations, but maximum they have achieved with the wild type anti-PD1 and IL-2 combinations along with the CAR-T that target the antigen of the tumors. And then they check the percentage weight change. So in the percentage weight change for the case of this anti-PD1 and IL-2, or for almost all the cases, the final weight change after 40 days is non-significant for all the cases. But in between they see a dip, but final weight change is non-significant. Then they check the IFN gamma, and IFN gamma values are almost negligible in most of the cases. However, in the case where IL-2 is used with wild type PD1 and with the mutant PD1, they are able to see some IFN gamma levels, and the IFN gamma levels are high when they use the mutant PD-L1 with IL-2, and when they use the wild type PD-L1 IL-2, they are able to see a reduced IFN gamma levels. And this shows that when there is a PD1 binding occurs in the TME, then they see a low amount of this IFN gamma formations. And this is kind of an interesting observations, and so it is not like something goes against the literature, but this is some kind of a new observations, and thereafter they check the percentage CD3 cells, and in the percentage CD3 cells there is not much useful information that one can get from percentage CD3 observations, but for this percentage CD8 plus observations they are able to see more CD8 plus cells when they use the IL-15. However, it does not have any effect. However, it does not convert those increased CD8 plus cells towards reductions in the tumor volume. That can be seen in the panel B, and the high CD8 percentage charge can be seen in the panel G. And thereafter they check the percentage CD4 plus cells, and CD8 plus cells are also known as cytotoxic T lymphocytes. That is, they directly attack the tumor cells. And CD4 plus cells are called as dendritic like cells, where they release cytokines to activate other immune systems. And these CD4 plus cells are significantly higher in the case where they use IL-2 compared to the wild type, and they are high for both mutant PD1 and wild type PD1 combinations with IL-2. Then they check the CD11B combinations, and the CD11B combinations they do not see any significant informations from this. And when they check the PD-L1 percentage populations in this CD11 B positive cells, and there they are able to see the percentage CD11 ligands are higher in the case of this IL-15 combinations, and along with this IL-2 and PD-L1 ligand combinations, and also they have seen some high PD-L1 ligand in the CD11B combinations are in the case of where they use IL-15 with wild type PD-1. This is what they find out. They find out that the PD-1 interactions with the tumor cells are higher in the case of IL-15 and IL-12. And in the finally, when they check they check this PD-L1 ligand populations in the CD11 positive and Ly6G negative and Ly6C positive, and when they check it for both the things are negative, the CD11B positive, Ly6G negative and Ly6C also negative. In that case, they are able to see the high PD-L1 ligand for the wild type mutant with IL-15, but not in the case where mutant PD-L1 with IL-15. So this indicates the functionality of, or the importance of this PD-L1 ligand, that it is working properly, or it has a role in the tumor diagnosis. Overall, they conclude that the CAR T cells along with this wild type PD-L1 and IL-2 bispecific antibodies results in the better tumor treatment or tumor diagnosis compared to the other combinations. So in the future studies, they should be focused on these combinations to check the other functional studies about its safety, efficacy, that we will discuss in the subsequent videos. That's all for this video, and from this video I have also included a written summary in the descriptions. So if you don't want to spend time in this video and just quickly want to understand about or get a brief idea about this figure, you can refer to the summary that is provided in the description. And if you need to understand about this experiments in detail, you can go through the reference that has been provided that has also been provided in the description. So that's all for this video. Thank you for your time.